So this exercise, or stretch I should say, is for the upper rib in the thoracic and cervical junction. So where the neck ends and the ribs begin, that first rib that comes down, the first rib's about the size of your thumb and your pointer finger in a C. Comes out from the base of the neck and comes around and tucks underneath the collarbones. And that rib has some specialized muscles that attach there, the scalene muscles, the anterior and middle scalene. On either side of that anterior and middle scalene are all those nerves and blood vessels kind of coming through that passageway. If that rib is elevated or those muscles are tight and pulling up on that rib, that can clamp things between the collarbone and the rib and cause shoulder pain, symptoms into the arm, thoracic outlet syndrome, if you've heard of that. That's all possible causes associated with a potentially elevated first rib. So this particular thing is going to be done after a shower because the tool for this is a towel. So we're going to use a towel. So if I take the towel and kind of roll it up as I'm drying off, I'm going to throw that over my shoulder. So let's say I have some symptoms on the right side. I'm going to throw that over the right top of the shoulder. The other side is going to be hooked kind of diagonal across the back. I'm just going to hook that into my armpit so I can just keep that from slipping out. Now I don't want to drag the skin down and get a skin pull, so I'm going to kind of come across the shoulder up and slightly down and in towards my center line, and now I'm going to anchor that rib down. At the same time, I'm going to add a stretch to stretch those muscles I mentioned earlier on the side of the neck that attach to that rib. So I'm going to tuck my chin in, so it's going to be kind of an unsightly double chin. And from there, I'm going to keep the chin in the whole time. Do not let that chin out at all. Chin in first. While the chin is in, I'm going to turn to the right with the chin in, and then thirdly, I'm going to tilt my ear away. So I'm turning my head towards the side of the towel and now tilting it away. And now I get a nice stretch right up almost into the ear, holding that for about 20 seconds or so, and then release it out. So anchor, chin tuck, turn, tilt. 20 seconds or so, release. You can certainly do both sides, but if you're coming to therapy for a specific symptomatic side, it's often the side that's symptomatic is the side that you would treat with the stretch. But to switch, I would just throw it over the other shoulder, underneath the arm, anchor, and in this case, tuck in, turn to the towel, tilt away, and there's that stretch. So I don't want that rib to come up with the tight muscles. There's two big muscles pulling up on that rib, but no muscles pulling it down. So an elevated rib can happen fairly frequently and get missed in terms of, misdiagnosed for things like shoulder pain, and even symptoms that go into carpal tunnel and things of that nature can be driven from an elevated first rib. So give that a try after every shower. You have hot water. You can do it before and after the shower. But it's a good opportunity, or anytime you visit the bathroom and that towel is sitting there in view, you can throw an extra stretch in and do that throughout the day to manage those symptoms. And over time, get those muscles to be less tight, and that in turn decreases stress to all those muscles and joints that those nerves innervate coming out of that area. All right.